adductor magnus.
That's from the ischial tuberosity down to the adductor tubercle here in the medial side.
The adductor longus and brevis.
Those both will be over here as well on the medial side.
The pectineus.
That's up by the groin.
Oh, the ASIS.
That is the pointy prominences up here.
The sartorius.
That's from the ASIS coming down and across to the pes anserine.
The rectus femoris.
That's this muscle.
The iliac crests.
Those are at the top of your hip bones up here.
The gluteus medius.
It's going to be kind of lateral, but of the butt here.
The tensor fascia lata.
That's at the top of the IT band here.
The IT band.
And right below that, through here.
The greater trochanter.
That's that bone sticking here.
The trochanteric bursa.
And that is on top of that greater trochanter.
The sacral crests.
I'll have you flip over. It's going to be right in here where that fuses.
The PSIS.
Those are right in here.
The gluteus maximus.
And that's just the big butt muscle.
The ischiotubrostomy.
And deep to that butt bone right there.
The sciatic nerve.
That's going to be from the ischial tuberosity to the greater trochanter.
And the hamstring muscle grips.
This will be medial, and this is going to be the lateral. Okay. Now I will have the patient doing active range of motion. She'll be supine. For hip flexion, I'll have her bring her toes to her head. I'll bring down, and then you can flip onto your stomach for hip extension, and now bring your foot to your head. Okay, and then laying back on your back, bring your leg out. That's abduction. Abduct this one a little bit, and then bring this one in. That's adduction. And then sitting at the end of the table, rotate your foot inward. That is external rotation, and outward is internal rotation. All those are normal for her. Next I'll do goniometer testing, starting with hip flexion. I'll have the fulcrum over the greater trochanter, and I'll have her flex her hip upward. And that looks normal at 122. Normal range is 120 to 130. Now I'll have her flip onto her stomach for extension. So same thing. I'll have you extend upward. And that is good at 19, about 20-ish. And the normal range is 10 to 20 there also. I'll have her laying down again. On the ASIS, the fulcrum will be, and I'll have the patient abduct this leg out. And that looks pretty good at like 43-ish, and the normal's 45 for adduction. Same thing, bringing your leg in as far as you can. That also looks normal at about 30. Internal rotation, I'll have you sitting at the end of the table. So now over the patella, now move inward for external rotation. And that is normal at about 45, and then move outward for internal rotation, and that's normal at about 50. Okay, I'll do some passive range of motion, having the patient on her back for hip flexion, and that'd be a firm end feel, and then again with her knee bent, that end feel would be soft. Then I'll have her flip onto her stomach for extension, bringing her upward, and then again the knee bent, and then up. Both those are firm end feels. And for flexion, the patient's hand is underneath their back to support them. You can have the patient hold that so you don't have to. Next, I will do abduction. She'll be laying on her side. And then I will lift the leg straight up with a firm end feel. And now flip to your other side. So you can test this same leg and bring this one over top and cross it. And then you want to just lift straight up. And that's a firm end feel as well. And then she'll be on her back again. And this is internal rotation and external rotation, which both have firm end feels. Now for manual muscle testing, she will flex her hip up again, bring your foot up, and I will provide pressure to that. And that is 5 out of 5. And now I'll have her sitting at the end of the table, and now she'll lift straight up again, 5 out of 5 onto her stomach for extension. Lifting up, 5 out of 5, and then bend. She'll lift up. Good, 5 out of 5. Side lying again. For abduction, lift straight up. Good, 5 out of 5. Rolling on your other side with this foot over, lifting straight up. Good, 5 out of 5. And then sitting at the end of the table. External rotation, so bring it inward. And then same thing outward for internal rotation. Good, both those are 5 out of 5, comparing all ranges of motion and manual muscle testing bilaterally. Now I'll have the patient laying on her side for iliac crest compression test. So I'm just going to be pushing straight down onto her iliac crest, and if there's pain with that, that'd be a posterior SI ligament sprain. Now she'll be on her back, and I'm going to cross my arms, applying downward and outward pressure to the ASIS, and if there's pain with that, it'd be anterior SI ligament sprain. Next is the fulcrum, so she'll be seated at the end of the table with my forearm under her leg, pushing down on her knee. If there's pain with that, that could be a stress fracture of the femoral neck. Next, hip scoring. I'll have her laying down again, supine. Knee flexed up. I'll be pushing down on her knee, internal and external rotation there. And then if there's pain with that, that could be articulating cartilage issues or a labral tear. Next, Fabers. She'll be in a figure 4 position. And I will push down on this knee. And if her knee wasn't able to go down and it stayed up, that'd be tightness of the iliopsoas. And Ganslins, whatever it is the next one. She'll be sidelined, and her bottom leg will be up to her chest. And I'm going to bring her into hip extension with the top leg. And if there's pain with that, that would be an L4 nerve impingement or lesion issue. Next, both legs extended for Obers, and I'm going to abduct the patient and then bring her into hip extension. And when she drops, the foot should drop below the table, but if it didn't, that'd be tightness of the IT band. That'd be a positive sign if it didn't drop. The Thompson and Kendall, she'll be supine at the end of the table with her knees to her chest. And now she'll drop this knee. And for a Thompson, a positive test is if the thigh stays flexed up. The iliopsoas group, that'd be tightness there. But for Kendall's, if the knee stayed extended, then that would be positive for a rectus femoris tightness of that muscle. Ely's, I'll have her prone on her stomach. And I will flex the knee. And I'm looking to see her back flex as well up by the PSIS area. And if it did flex or arch, then that'd be positive for rectus femoris. And now I'll have her standing for Trendenbergers at like the PSIS level. She'll shift her weight to 1 foot. And I'm looking to see if the non-weight bearing hip drops. And if it does, that would be weakness of the gluteus medius on the weight bearing side. You do that on both legs, obviously. And last for that is the piriformis test, sideline, with this knee over, I'm going to push down, and that's going to stretch out the piriformis. And if there's pain with that, it could be tightness or piriformis syndrome, which is impingement of the sciatic nerve where the piriformis muscles are squeezing it. So next, the femoral nerve traction test. Side lying, I'll have my patient with her knee flexed to 90, and then I'm gonna keep it in 90 and then bring her into a hip extension. And if there's pain with that, that could be issues of the L2, L3, or L4 nerve lesion or impingement there. And then the hamstring tendon reflex test, I'm going to find the medial and lateral tendon there, and I'm going to tap my thumbnail over both sides. My patient is obviously have a nerve lesion. So the medial side is testing L5 and S1, and the medial side is L5 and S1. The lateral side is testing S1 and S2. If they both don't fire bilaterally, that is an upper motor neuron lesion, and if they unilaterally don't fire, then that is a lower motor neuron lesion. So now I will go on to myotomes and dermatomes. Patient's eyes would be closed. I'd ask them to repeat if it's sharp or dull for dermatomes. For L1, the high groin up here, sharp, dull, sharp, dull. Low groin for L2, sharp, dull, sharp, dull. L3 is about mid-thigh, sharp, dull, sharp, dull. L4 is over the patella, sharp, dull, sharp, dull. L5 is around the tibia, sharp, dull, sharp, dull. S1 is going to be the lateral hamstring, sharp, dull. And then S2 is medial, sharp, dull. And then for myotomes, for those, L1 is hip flexion as well as L2, so foot to the sky. And then L3 is knee extension, so sitting at the end of the table, the patient will just flex her knees straight outwards. L4 is dorsiflexion, so toes to the sky. L5 is just great toe extension, so bring that big toe up. S1's plantar flexion, foot on the gas. S2 is knee flexion, so just bring your knee straight up. And then for L1, there's no reflex testing, but L2 through L5 is the patella. There we go, a little motion there. And then S1 and S2 is the Achilles. Little motion there, okay, so thank you.